and welcome back to the Yes Means Yes podcast. On this week's episode, we have coordinator of the SANE program at our local EAMC, Allison Kennedy, on to discuss her job as a SANE nurse and kind of like what all that entails and how we are able to work together. As usual, my name is Faith Nomchef. I'm the victim advocate and outreach coordinator with Rape Counselors. I'm going to go ahead and let everyone go around and introduce themselves.
Hey guys, I'm Amanda Carpenter and I'm also with Rape Counselors of East Alabama, and I am a victim advocate and outreach specialist.
And my name is Dondra Williams and I'm an intern at Rape Counselors.
And I'm Allison Kennedy and I'm a sexual assault nurse examiner at East Alabama, or SANE nurse.
Perfect. So let's jump right in, Allison. What does SANE stand for? What is that?
So SANE is an acronym that we use, and it means Sexual Assault Nurse Examiner. We are specially trained nurses. We're all nurses and have that background, but we also take additional training to be specially trained just to take care of sexual assault patients.
So whenever you say SANE nurse or sexual assault nurse examiner, which means you give like forensic exams, and some people call them rape kits. Can you kind of explain what that process looks like?
A lot of people come in asking for rape kits. We like to call them forensic exams because they encompass a whole lot more than just evidence collection. They have a lot of different parts to them. One part is that we do evidence collection. So after a sexual assault, within 72 hours of it occurring, you can come in and see one of us at the ER East Alabama Medical Center. We'll see you. We'll do our evidence collection. It's basically a head-to-toe physical assessment of the patient where we look you over from head to toe. We look at all aspects. We look at injuries, any complaints that you have. We're going to focus in on that. But we also do evidence collection. That kind of scares a lot of people when they come in because they don't know what that means. Basically, we take Q-tip swabs, and anywhere that you tell us that might be important, say there's a place where there was kissing or touching or something happened, we would swab that with a Q-tip. We don't use anything that's sharp or going to hurt you or anything like that. That's one part of what we do. Another part of what we do is we do offer like drug screening. If you feel like you've maybe ingested a substance that wasn't given to you, don't remember some parts of the evening, we can do a drug screen on you within 72 hours for that. And then we also provide prophylactic STI treatment. So at the ER, we don't test you for like STDs, STIs, but we would treat you to prevent you from getting those kinds of infections. Along with that, we also offer pregnancy prevention, kind of like Plan B. Ours is called Ella, but it kind of works the same way where we would prevent pregnancy through that medication that we provide.
Can anyone get a forensic exam?
So anyone, as long as it has occurred within the last 72 hours, you can present and get a forensic exam. We see all people, all sexual preferences, anything that presents to the ER, we will come in and see. We can only see patients within that 72 hours, but as long as it falls within that time frame, yes, we can come in and see you.
So if someone were wanting to come in and get a kit done, is there any advice that you would give them, like things to do beforehand or not do?
So we would ask, if possible, and I know it's hard sometimes, but if possible, we want you to try not to drink anything. If you are really thirsty and need to drink something, water would be the best choice for you to take. We ask you not to eat anything. Obviously, that happens sometimes, and we don't want eating or drinking or any of those things to be a deterrent from you coming in. We can still do an exam even if you do those things. We would like for you not to change clothes, but if you do change clothes, bring those with you. Try not to shower or bathe or do any kind of wipes or washes, douches, things like that. But again, if you do those things, that doesn't need to be a deterrent from you coming. We will still see you. We can still do the exam and everything just like normal. Those are just things that are preferable before you come in to not do.
And can you kind of tell us about like the insurance and how it costs and all of that stuff? Like if someone wants to come in, do they have to give their insurance card? Do they have to pay for this exam, or is this something that's free of charge?
No, if you come to us within 72 hours and you see a SANE nurse at the ER or at AUMC, AU Medical Clinic, that exam is free of charge. Any medications we give are free of charge. You do not have to have insurance. You don't have to give us your insurance. It won't be filed on your insurance. The forensic exam, the prophylactic treatment, all of that is free to you. It's all reimbursed by the state, so there's no cost to the patient.
And anyone that's doing the exam, they can stop the exam at any time. Just because you start it, they don't have to go through the whole thing if they, in the middle of it, change their mind. Is that right?
Yes, every exam is tailored to the patient. Because we have the different aspects like the evidence collection, the drug screening, the medications, those are all different aspects of our exam. You can get part of the exam. So you could come in and just get prophylactic treatment and medication if you wanted. You could come in and just get a drug screen. We can just do, whatever part is what you want. We can tailor that exam to you. If at any point in time we start an exam and you decide this is not something you want to do, for any reason, we will stop. We never force anyone to have a forensic exam just because you come to the ER.
And they do not have to have, just because they do a rape kit or forensic exam, the police do not have to be involved unless the survivor wants the police involved. Is that correct?
Anyone 18 years and younger, we are required by law to report to either DHR or law enforcement. Anyone 19 years or older can come in, receive all of our services, receive an exam, medications, drug screen, all of those things. And you can do what's called an anonymous kit or a Jane Doe kit. So you can get all of that without ever involving law enforcement if you don't want to.
Can you tell us a little bit more what you mean by Jane Doe kit?
Sure. So an anonymous kit or Jane Doe kit, both terms can be used, and you may hear either one, just means that you present to the ER and that you express that you do not want law enforcement involvement. As long as you are 19 years old and older, we can do that. We can do all of our services and never call law enforcement. You do not have to report that. Those kits are collected just like we would any other exam. You're given the medications, drug screens, anything that is applicable to that exam is done. We save those kits at the hospital for up to 90 days. And we would get you just to sign a form saying, you don't want law enforcement involvement, and that we would save your kit for 90 days. So that gives you 90 days to decide, because at the time something happens, you may not know what you want to do. You may not, you're still processing a lot of things. So that gives you a little bit of time to kind of make those decisions and process what's happened before you have to involve law enforcement.
So what if someone after the 90 days was still unsure? Would you hold it longer if it was requested?
So we can guarantee the 90 days. I hold my kits as long as I possibly can. Storage at the hospital is limited, but I do hold those kits up to as long as I can. Unless I run out of storage, I don't get rid of exams. And in the past, when we have had to get, have gotten rid of some of the kits, we've contacted rape counselors. We've tried to get in touch with the patient to find out what their feelings are. Are they still deciding? Are they still thinking about it? So we do try to make that contact before we get rid of any kind of evidence or kit.
Does every hospital have a SANE program?
So no, our program at East Alabama is a little bit unique. A lot of bigger cities like Montgomery, Birmingham, Huntsville have what's called freestanding clinics, which are clinics that you can go to get exams outside of the hospital. There's very few programs in the state of Alabama that have SANE nurses who come into the hospital routinely and are based out of the hospital. Dothan does have one, and then we have one. Otherwise, if you present to a hospital, you're sent to an outside clinic. So our hospital is a little bit unique in what we have. It's very nice that you can go one place because sometimes you don't know where to go, and you can just go to the ER and the SANE nurse will come to you.
Okay.
So, and this is just like an estimated average, how many victims would you say that you provide services to just on average a year?
So our numbers have been growing over the last few years, which is a good thing. I mean, a bad thing and a good thing. It means this is happening all the time, every day.
Right.
This means more people are actually coming forward and coming to the hospital to get exams. Last year, we had around 80 to 85 patients that came in, which is our biggest year since the program started. So more patients are getting to know that we're here. They're coming in. So that is a very good thing.
Yeah. And I think that's also something we hear a lot too. They're like, is it like becoming more prevalent, or are people just feeling more comfortable coming forward? And we like to believe that people just feel more comfortable coming forward because it obviously has always been a problem.
And that's the thing. If you look at the national numbers, and if you look at the ratios and everything that the amount of people that this happens to, it's not that it's happening more. It's that people are reaching out more. People are becoming more aware that we're here. People are feeling more empowered to even come forward and say that this has happened in recent years. So I think that's why we've seen our numbers go up. It's not because I don't believe it's because it's happening more, but people are actually more comfortable coming in and saying, hey, this has happened and I need help, and what can I do? So that, to me, it's a good thing that our numbers are going up, because I know it happens. Right. More people coming in and seeking care, and that's what we want.
I like to think that means that we're doing our job.
Exactly.
Yeah. So we serve like 4 counties: Lee, Macon, Tallapoosa, and Chambers. Do y'all serve a certain area, or is it just kind of like whoever comes in?
So we will see anybody that comes in. We see people from LaGrange. We've had people from Roanoke. We have people from Alex City, Tuskegee, Russell County. We don't have a particular area that we serve. There is really no other hospital around that does what we do. So even the outlying hospitals are sending people to us because they know we have this program, which is really good, because you want a good exam. If something like this has happened to you, you want to know that you have someone who is capable of doing this exam. So we will see anybody. We've seen, with Auburn University being here, we've seen a lot of patients that an assault has happened in another state, and they come back to school, and now they want to seek care, so they come to East Alabama. So we've actually had cases from California and a lot of other states that have presented to our ER.
How many SANE nurses does East Alabama have?
Right now, we have about 8 nurses that are trained. Now, those nurses are not in the hospital all the time. We kind of do that. We all have full-time jobs, and then we take call and we come in our off time. So we're not always present at the hospital, but we have about 8 nurses at the hospital that are SANE trained, that are ready to respond if someone presents.
So are you employees of the hospital, or just independent?
No, everyone that we have right now is an employee of the hospital. I think all but one of us is actually ER nurses. So we're not only trained in SANE, we take care of trauma, we take care of all kinds of patients. So we're well equipped to handle any kind of trauma and assessment of patients. The one nurse that doesn't work in the ER actually has an ER background. So we all have similar backgrounds and similar jobs.
So if someone wanted to become a SANE nurse, what would that entail and how would they go about that process?
That is an awesome question because I get asked that a lot. We have a lot of people that come out of nursing school and want to do it and are really interested in it. You do have to have 2 years of nursing experience. It can be any nursing experience. It doesn't have to be anything. It doesn't have to be ER or mother baby or women and children's. Like, it can be any type of nursing experience. You just have to be a nurse for 2 years. And then there's a 40-hour didactic training that you have to take. Once you complete that through a certified program or an established program, then you go through kind of like a clinical time where you learn the hands-on, like exams and that kind of thing, equipment use. Then there's a small preceptorship that we do at our hospital where you actually go in and do exams with a trained SANE, and then you can become a SANE in our hospital. And most programs follow a very similar pattern to that. But you do have to have 2 years of nursing experience before you can take the SANE class.
And is it for registered nurses, practical nurses, and can you be any registered nurse, or do you have to have a 4-year degree?
No, any 2-year nursing degree. You do have to be an RN. As far as I know, the guidelines do state that you have to be an RN. But any RN, it does not have. You don't have to have a bachelor's or anything like that.
Okay, thank you.
Yeah, because we actually, we go in and talk to college students all the time, and that's one of the questions they will ask us. So that information is definitely important.
No, and I have several nurses who are like, either at our last class, we're almost at 2 years, or are now at 2 years, or fixing to be at 2 years, who ask me all the time, when's our next class? We really want to do it. So that 2-year mark is just to get you a lot of experience in like assessment, because you're working independently. When I go in, most of the time, 95% of the time, I see a patient by myself.
Right.
So I have to be proficient in doing a physical exam, knowing when to bring a doctor in, knowing how to watch for, signs and symptoms of trauma and different things. So that's why the 2 years is there, because we do work very independently. But I have a lot of people who ask me all the time, who come out, who have heard y'all talk or heard, from other people about SANE, and they really want to do it, but they're just waiting on their 2 years. So.
Yeah, my mom is a nurse, and I'm really trying to get her to be one because I think she would be an excellent SANE nurse. And I know she listens to this, so Terry, the pressure is still on. I still think you should be a SANE nurse.
Well, she needs to do it.
I know, she would be great. But so I like to think of RCEA and the SANE program EAMC as kind of like a partnership. What would you say are some of the benefits of having an advocate present during a SANE exam? Even just like in other instances, like not just even between us, but just having an advocate present during any exam.
So when we come in as a SANE, we're going to try to give you, we're going to try to be there for you. We're going to try to provide you the best care. But at the end of the day, we are non-biased medical providers. I can't necessarily be on your side or be against you. That's not my role. My role is to do an assessment on you, to make sure you're healthy, to make sure you're medically okay. The advocate can come in, and all they're there for is to support the patient. So when I'm doing my exam and I'm, getting swabs and doing things, or charting or documenting, sealing things, my focus is not always on the patient right at that moment, because I have other things that I've got to make sure I do exactly right. So if this does go to court, it's admissible in court. Whereas if I have that advocate, their whole purpose is to be there and focus on that patient. So they're there to support them. They're there when I'm kind of focused on my paperwork or something else, they focus on the patient. And without that, the patient can kind of feel, I guess, I don't know a good word, but they can feel like that focus is being taken off them. We want to give them as much focus as we can as a nurse, but we do have other things that we're looking at and other things we do have to do to make sure that we do everything accurately, whereas the advocate can just focus on them during that exam. Now, of course, y'all's role goes well beyond the exam, but for that time, if they need a hand to hold or somebody to support them, somebody just to talk to about things maybe they don't want to talk to me about, or maybe I'm doing something else and they can talk to y'all, I'll talk to them about they like different things to get their mind off what's going on. So having y'all there is a really awesome thing because you're just there to make sure they're comfortable, they have what they need, and that the focus is always on them. So we love having y'all come because sometimes we do have to focus on our medical side and our documentation and stuff, and y'all can just sit there and just focus on them.
Right. Well, we appreciate y'all letting us come and being able to provide those services because I'm sure that's not an option in every ER or program.
No, it's not. And our policy is to go ahead and, and to call an advocate. Every patient that comes in, we try to go ahead and call the advocate in because sometimes the patient doesn't even know they want or needed that support person until they get in there. And then y'all become such a huge part of that process. Like I said, when our focus may be on other things, y'all are just there to focus on them and y'all give them so much support. So it's awesome having y'all there.
I also think that like a lot of people think that, when someone's been sexually assaulted, that they have somebody there with them, that they have like a support system. And I think a lot of the time, I would think since I've started with rape counselors, I would say more of our survivors do not have anyone with them when they come in. That may be because, they're from out of town. It may be because they're embarrassed. They don't want anyone to know. And so I think that too also plays a big part is I think a lot of people are like, oh, well, they have someone. Sometimes some people just don't have anyone that they feel safe with. And so that's kind of a part of our job. And I think that's the reason we tell them, y'all are phenomenal. Like SANE nurses, y'all are awesome and y'all do so much. And so it's good for them to know that y'all are so awesome with them and do everything that you need to do for them. But once they leave there, your job's kind of done. And right. So that's kind of where we can step in and we can continue that process of helping them the way they need to be helped. So we truly just appreciate you guys, all of you. Y'all, every nurse I've worked with, SANE nurse that I've worked with, it's just been phenomenal. So kudos to you guys, gold stars for sure, because y'all definitely have, y'all are doing good stuff out there. So I just hope the community knows just how important you guys are and how lucky East Alabama Medical Center is to have you guys.
Well, I thank you for that. But that is why, like you said, a lot of people, you would think most people that come in do have like a support person or do have somebody with them. And a lot of them don't. They come in all alone. And like you said, either they haven't told anybody, they're embarrassed to tell somebody. For a lot of different reasons, they may come in alone. Maybe their roommates don't have a car and can't get there. They have class, they have study time. Like there's all kinds of different reasons. We see community cases all the time where it's moms who don't want their family to know, don't want their kids to know because they don't want them to worry. So having an advocate there provides that support person that maybe couldn't be there for them or maybe they're too embarrassed to bring in. And y'all come in as a non-judgmental, I'm just here to support you kind of person. And it's awesome to see that. And for them to have somebody at the bedside with them who can be through them with that process. And like you said, once our exam is done, really our role is done. Again, we're supposed to be non-biased medical providers. Now, some of us get a little more invested probably in cases than we're supposed to, but once you leave the hospital, I can't call you and check up on you. I can't call and see how you're doing. That's not my role. My role is to make sure medically you're okay. Whereas if we connect you with the advocates, y'all can call up and check on them. Y'all can call and be sure they're okay. Y'all can call and make sure do you have resources that you need and things like that. So we all have to work together to get everything done, but y'all's role goes so much further than ours in the long run with them because I can't call and follow up with everybody.
Which is why it's so important we have this partnership, I think, too.
I know. And we love our partnership.
Yes. We love working with y'all, for sure.
So what can the community do to help the victims or survivors that you see during the exam? Are there any kind of care packages, because I know with rape counselors, we can help offer clothing and we try to do care packages, but we're also having to get out there and ask the community for these items because we are a nonprofit organization. So what are something, if someone was listening that wanted to help you guys, what is some items or something they can do to help your SANE program work even smoother than it already, it is working?
I don't know of anything specific to give to us. Unless you want to donate money, then we'll take it. But other than that, as far as items, if you ever wanted to donate something to patients into the SANE program, I mean, you could always bring them to East Alabama. We would get them and probably give them to rape counselors. Of course, help rape counselors as far as I think y'all are doing care packages or trying to collect supplies for care pack, which is huge. Because so many of these patients come in and, they may be displaced from their apartment. Maybe they're scared to go back there. Maybe they can't go back there for different reasons. They're going to be put somewhere else or stay with a friend, and they leave and they literally have clothes because y'all provide those, which is awesome. We don't have to send them out in paper scrubs, but they may not have, toothbrush, toothpaste, just those little things that make you, a comb or a hairbrush, just those little things that would be really important they don't have. So we would love to see some care packages put together for these patients that we can give them something when they leave in case they are displaced, or just to make them feel a little bit better, or make them feel like they're thought of or they're cared about. We would love to have those care packages to give out.
Yeah, I think it would be a nice little sense of comfort, just something to kind of hold on to and take with them. And I know some places I've seen that they've partnered with a local church group or something, and they're able to give blankets to every survivor that goes home from the hospital. I think something like that would be amazing.
Oh wow, that would be awesome.
So any church groups listening, you know how to sew.
And I have been trying to get in with some church groups and some different places and try to get some of those things going with y'all. Because like you said, I mean, when you come in for an exam, we try to tailor it to you. We try to make it as good of an experience as I can make something like that be for you. We try. But in the end, when you leave, you may have given me your clothes. You may have given me your sheets. You may have given me stuff that's important to you. So to be able to leave with clothes from rape counselors is amazing because I don't have to send you out in a gown or something crazy. You actually have clothing to put on, a bra and a panties and socks and things like that, leggings and shirts. That's a step up from a lot of places that I hear about. And then if I could just give you something that kind of is comforting, like I said, just something little like some toiletries or a notebook or some pens or something to send you out with where you feel like, yeah, I had to give up some things, but I'm at least leaving and feeling like I was cared about and thought about, and like I'm important. So I'm really excited about getting some care packages together.
What message, Allison, do you have for survivors?
That's one question I've been thinking about. The biggest thing for me, I guess, coming from as a SANE nurse from the hospital is if something's happened, like I said, we can only see a SANE nurse can only come in within a 72-hour period. But if something's happened to you, to a friend, to a loved one, whatever, please come in and let us see you. We want to provide this medical care for you. If it's just coming in and talking to us and seeing what your options are, we're there to do that. I never want a patient to feel ashamed to tell me what happened. I never want them to feel like I'm not going to take them seriously. I take every case seriously. I take every patient's, dignity to heart. I want them to feel listened to. I want them to feel respected. So please come and see us. Our nurses are trained to do that. We have a lot of nurses who really care about this program and who really want to be out there and help patients. A lot of us have either been assaulted, have loved ones who are assaulted, have friends that were assaulted, and that's why we do this. So we want you to come to the hospital and seek care, or come to AU Medical Clinic during the daytime hours. I think it's 8 to 2. and seek that medical care, because there's nurses there that aren't just there because they have to be. We're there because we want to be. We volunteered. We signed up for this program. This is nothing that's mandatory for us. We do this because we want to be there. So we want you to come in and get that care, whatever that may look like, whatever parts of our exam you may want. We want you to come in and we want to see you and take care of you.
Well, thank you so much for joining us today, Allison. We love just talking to you and seeing you. And of course, we appreciate everything you're able to do for victims and how positive I believe you and the other SANE nurses are able to make their experiences. So again, thank you so much.
I'm so excited that you asked me to come on.
So enjoyed it. For everyone listening out there, thank y'all for joining us. Thank you for listening. Thank you for supporting us. If you are interested in helping us out with these characters, because we do need some help with toiletry items, chapstick, anything you can think of, I am going to put a couple of emails that you could reach out to at the bottom, or even just our office line, so that we could maybe get those items from you if you were willing to donate. But thank you guys again for listening, and I will see you on our next podcast. Bye.
Thanks.